Can the position of your maxilla cause or contribute to hair loss? To start off, it's well known that poor circulation and tension in the scalp can contribute to balding. Just like how clenching your fist can turn your knuckles white by reducing blood flow, similar tension can reduce blood flow in the scalp. Vasodilators like minoxidil, which expand blood vessels, are often used to increase circulation in the scalp and stimulate hair growth. Scalp massages have also been found to help reverse hair loss, with massages improving circulation and reducing tension in the area. So how does the maxilla fit into this? There is an artery in the skull responsible for 85% of the vascular supply to the scalp, called a superficial temporal artery. This artery runs just behind the mandible to lower jaw and proceeds to branch out over the scalp. When the jaws are set back because they haven't grown correctly due to mouth breathing, bad posture, and a soft diet, this artery can become constricted between the base of the skull and the mandibular condyle. Jaws that haven't grown correctly can change the entire shape of the skull, so it's not surprising that this change in skull shape has the potential to inhibit circulation or increase tension in the head. Similarly, people who have a maxilla that is set back also have constricted airways and usually give themselves forward head posture to keep their airways open. Because human beings are social creatures, we tend to keep the point between our eyes and the point of our chin above each other, regardless of where the jaws are. Because of this, people with forward head posture will tilt their head back slightly, which gives the forehead a sloped back appearance and can make the hairline appear further back than it actually is. Forward head posture, along with tilting the head back, both add tension to the scalp. You can try this yourself by doing a chin tuck and then giving yourself forward head posture and trying to feel which position you can feel more tension in your scalp. People with malocclusion or jaws that didn't grow correctly are also more likely to suffer from jaw joint issues, grinding and clenching, all of which have the potential to add tension to the scalp. They're also more likely to mouth breathe. Mouth breathing actually reduces circulation in the body by expelling too much carbon dioxide, which is a vasodilator. Mouth breathing also bypasses the nasal cavity, where nitric oxide, another vasodilator, is produced. Mouth breathers have poorer overall circulation than strict nasal breathers. Weston A. Price, a dentist in the 1930s, studied communities living more traditional lifestyles. He found that these people didn't suffer from the same rates of crooked teeth and poorly developed jaws that are so common today. He also noted that the people he studied in his work had thick hair, with recession and bald spots being rare, indicating that our modern environment and lifestyles contribute to the condition, and just like crooked teeth, have a huge environmental component. While these ideas are just theories, and a lot more research needs to be done in this area, it is highly likely that poor maxillary development contributes to hair loss through increased scalp tension, potentially restricting the superficial temporal artery, adding to poor head and neck posture, which can contribute to both scalp tension and reduced circulation, and with the mouth breathing that is characteristic of poor craniofacial development, reducing nitric oxide and carbon dioxide in the blood, which leads to poor circulation overall. Thanks for watching.